Welcome to the 5th edition of Chemelot InSciTe's annual meeting. My name is Marcel Wubbels and I'm your host of today. And next to me is Ingrid Grimberg.
Nice to welcome you.
As you can imagine, with Corona, it is impossible to have a live meeting and we all miss that. But nevertheless, we have a very exciting program for you where we will be discussing progress in InSciTe projects and also the reasons why we do those projects. We have several guests that will join us to give their perspective on things, and that is what we're going to be talking about today. The program is as wide as what does it take for a scientist to become an entrepreneur, ranging all the way up to how can we in InSciTe green up the European manufacturing industry to become more sustainable. So that is what we're going to talk about. But first, Ingrid, I see you all over the place in InSciTe. I see you at the website, at the news sites, in the biobased plant, as a lab assistant, as an eye patient even. So how does that work?
Well, Marcel, at InSciTe we find it very important to inform a large audience about the developments that we are working on, because eventually they can have great impact on both man and society. And that's the reason that we use video a lot, because that works really well. And I'm always there to support these shoots, and so I'm actually always the designated stand-in wherever I'm needed, so that's why.
Okay, so how is it like to work at InSciTe?
It's great to work at InSciTe. It's an open innovation platform and you get to learn about new developments almost every day. And in my job as a communications manager, but also in the education program, I get to work with a lot of highly motivated and very inspiring people, both in my team, but also in the community. So that's a great joy, really.
Okay.
And you, Marcel, you were involved at the very beginning, right, of InSciTe?
Yeah, thank you. Yeah, I was in the early days of InSciTe, so actually before it became a legal entity, we needed some time to really have all the parties aligned. And I actually had the pleasure to be on the board and serving as a board chair for only 1 year. And then I left the company, DSM, and moved somewhere else, so I also lost track a little bit of InSciTe. So that's why I'm very happy to be your host today. And I've seen a lot of good progress ever since then. So I'm really excited about what we're going to offer you. Enough about me. What is your role in the program today? We have a special role for you.
Yes, well, next to your role as being our talk show host today, I will be your social co-host, which means that I will invite you to actively participate in this event and invite you to ask questions and to vote in our polls, which will Marcel further explain.
Yeah, so how does it work? We want to have an active and live interaction with you as an audience. So there are two ways of interacting. The first one is you can ask questions anytime during the show using the chat box. So if you put questions there, Ingrid will pick them up and we will address them during the show. On top of that, we also have some questionnaires where we would really like to probe your opinion on certain things, and that we do via Mentimeter. So if you go to menti.com on your computer or even on your iPhone, it doesn't really matter what you use, and type in the 6-digit code that you now see on your screen, you will be given access to our questions. With that, I'd like to invite you, Ingrid, to go to the social room, and yes. I will see you in a minute.
Okay, thank you. Enjoy the
so
show.
Just to repeat, if you have any questions during the program, put them in the chat box and we will pick them up from there. And on top of that, for the questionnaire, go to menti.com, type in the 6-digit code, and you will see the questions that we have prepared for you. Welcome to the show.
Well, welcome to the show. All of our viewers have chosen to join a specific live stream today, either a biomedical live stream or the biobased live stream. And what is actually the difference between those two? Well, you will be watching different documentaries today, but as soon as we get back to the talk show sessions, you will be watching the same talk show. So it's parallel and sometimes it's a joint talk show session. Before we start with more information about InSciTe and the projects, we would also like to get to know our audience a little bit better. So the first questions we would like to address to you, and that's also a good way to test the Mentimeter. We have some questions about how many viewers are actually watching now, the biomedical live stream or the biobased live stream. You can go to mentimeter.com and submit your answer. What are you watching, the biomedical live stream or the bio-based live stream? So either A, biomedical, or B, bio-based. I'm curious to see the answers there. So let's see if we already have some results. It's a little bit 50-50, a little bit more biomedical viewers and, 42% bio-based sessions. It's adding up, it's adding up. Okay. What might be good to notice also is that if you would like to view the other live stream too after this event, that's possible. We will send you more information about that so you can watch the extra live stream too later this week. Second question is, what type of organization do you represent? Is that A, you're a member of the Chemelot InSciTe team? B, you are working in the industry? C, you are working at a university? Or D, you represent a different organization? So we're wondering where you work, actually. So is that A, Chemelot InSciTe, B, industry, C, university, or D, other? Let's see if we already also have some results about that. And yeah, the majority is working at university. But we also see almost 20% of industry members here, which is also really nice to see, and some other type of organizations. Thank you very much. Last question in this first Menti test. Yes, we're sorry we couldn't be able to organize the live event this year because of these specific circumstances. And we're wondering, what do you think about the live event not going ahead? You could choose answer A. It's awful that the live meeting is not going to take place, and I mean especially the part where we have the drinks. B. I really like the fact that the event is digital, so now I can watch it in my pajamas. Or C. I also think the live event is a lot of fun. However, I've never been invited. So, I'm wondering, I could take a wild guess. I think answer A will be winning here. And yes, I'm correct. It's awful that the live meeting is not going to take place. And I mean, in particular, the drinks. We'll be giving back the word to Marcel to find out some more about the talk show and our guests. Back to you, Marcel.
Thank you, Ingrid. Well, first of all, I would like to congratulate all of you for passing the Menti exam. That worked really well. But these are, of course, the simple questions. There will be some more challenging questions later on. So let's continue the program. Our guests of today are Ludo Deels, the Flemish Institute. He's representing the Flemish Institute of Technology Development. And he's also chair of the advisory committee of SPIRE. Welcome, Ludo. Patricia Dankers, Professor of Biomedical Materials at Eindhoven University of Technology. Welcome, Patricia. Koen Jansen, Vice President Innovation at DSM Biomedical. And also for Sustainability at DSM. Rhiannon Grant, postdoc at the Merlin Institute of Technology, Inspired Regenerative Medicine. I'm very glad that there's also an abbreviation for that. Welcome, Rhiannon. Then Yvonne van der Meer. She is the scientific co-director at the Aachen Maastricht Institute of Bio-Based Chemicals and Materials. Welcome, Yvonne. Bernard Mulder, General Director at RegMed XB. Welcome, Bernard. Danny van Osch, Chief Business Officer at Vertero. Welcome, Danny. And Emiel Staring, Managing Director of Chemelot InSciTe. Some of the things that we will discuss. Should property rights lie with the entrepreneur? And should the university invest more in entrepreneurship? That and more is going to be what we talk about with Emiel, Danny, Bernard and Yvonne. But first, back to Ingrid.
Please meet Henny Beckers, an extremely motivated eye surgeon, striving for the best treatment possible for her patients who suffer from the eye disease glaucoma. Together with her team and with the help of a US company, she is on a global mission to prevent millions of patients with glaucoma from eventually turning blind.
We have still a large unmet need to treat glaucoma better than we do now.
Na een aantal jaren van intensieve behandeling met druppels en uiteindelijk een chirurgische ingreep aan mijn linkeroog ben ik desondanks blind geworden aan dat oog. Mijn rechteroog heeft dezelfde behandeling inmiddels ondergaan. En mijn grootste angst op dit moment is, word ik aan dat andere oog ook op termijn blind? Ja, die gedachte, dat houdt je 24 uur per dag bezig. En met name ook 's nachts. 's Nachts in de vorm van paniekaanvallen. Van gauw even het licht aandoen en kijken of je nog zicht hebt in dat oog. Een nieuwe behandeling zal voor mij in ieder geval kunnen betekenen dat er een enorme onrust die nou in me zit weggenomen kan worden. En dat ik in ieder geval voor mijn gevoel zekerheid heb dat ik mijn zicht nog vele jaren mag behouden.
Glaucoma is an eye disease that is mainly characterized by optic nerve damage and visual field loss. It's a silent disease that will damage the optic nerve of patients for a long time, and then they only realize that when they start getting blind. It's a disease that is mainly caused by an increase in the intraocular pressure, and this is mainly due to an unbalance between the production and drainage of aqueous humor, the clear fluid that we have in our eyes.
Glaucoma is the most common cause of irreversible blindness worldwide. We have already 67 million people going blind from glaucoma in 2020, and it's expected that this number will even rise to 112 million by 2040. So we need to find better solutions.
The goal of this project is to develop a new minimally invasive glaucoma implant. So this implant will have flow control properties, will have a system that will enable to deliver antifibrotic agents in a controlled manner, and will have also topographies at the surface that will enable to modulate the cell response of the tissues that will surround the implant after implantation.
Flow modulation on an individual basis to individualize the treatment. This is no one-size-fits-all opportunity that we have. A lot of the current implants for glaucoma are made of silicone, medical silicone, and the silicone material in itself causes inflammation, and inflammation leads to fibrosis in the long term. So this material is not optimal. So the combination of new material for this concept that we have in mind is unique.
My passion is organic chemistry and polymer chemistry, which is just larger organic molecules. Actually, when I was in my early 30s, being the inventor of the angioplasty balloon and some of the coronary stents, including the ones that have drugs on it that elute into the heart. I found early on that conventional materials cause inflammation in the body. So I asked myself, how would I design a material that won't degrade? So I came up with a design, very difficult to make, which for short we call SIBS, S-I-B-S. And when I found out that if you have a material that can't degrade and doesn't degrade, the body doesn't even know it's there.
I got the opportunity to write a plan to treat glaucoma, and then the opportunity to work together with InSciTe came along. This gave me a unique opportunity to write a proposal that I could really put my heart into. We got the opportunity to assemble a really nice consortium of people from the Technical University of Eindhoven And the cooperation with Len Pinchuk and his team from InFocus Miami is really something that it's a golden opportunity.
This research is different from others that I did before because this one we are actually developing an implant that we aim to introduce into the market.
Without InSciTe, I wouldn't have ever had this chance to think in this way and to achieve something in this manner. They gave us all the opportunity to cooperate and to make something happen. And that's what I like so very much about this cooperation, and I hope we can continue this in future.
So the facilities that we have at Eindhoven University of Technology, but also from InSciTe, will help us to get the prototypes ready and faster to introduce it to the market, to the industry.
We have the unique combination of a unique new material and a unique consortium of people that really have the opportunity to do this.
Having a glaucoma implant which has flow control properties that allow the ophthalmologist to control the flow of aqueous humor through the implant after surgery in a non-invasive way is already something unique. But adding to that the fact that we will have as well a drug delivery system which will release antifibrotic agents in a controlled manner is something that improves the probabilities of getting success after the glaucoma filtration surgery.
The first challenge was basically to find a polymer that would degrade and not cause a problem in the eye. So we narrowed it down to several. And then we had to be able to mix it with the drug. And then the question is, how do you get it to release at the rate you want? And now we're working on the controllability and the fine-tuning of the release rate.
And adding to that, the fact that we are developing also microtopographies to include at the surface of the implant that will help modulating the cell response. I think that there are three combinations that I do believe that will improve the success of glaucoma filtration surgery.
The doctor will sleep better at night, knowing that the patient is protected. You're not going to get these large swings of pressure that you do with current procedures. So the doctor's happy, the patient is happy, and this is better for everyone.
We are now working on the fabrication of prototypes, and the next stage will be testing in vitro, and then testing in vivo is our goal.
And we're actually making progress. I know that my company, Santen, would be very interested in partnering in this.
If we succeed, and I do believe that we will succeed with this new glaucoma filtration surgery that we are developing, I think that this will have a huge impact in glaucoma patients' lives. This will improve their quality of life.
The next topic that we're going to discuss is entrepreneurship. We will discuss that with Yvonne van der Meer, Scientific Co-Director of IMEBM, Bernard Mulder, General Director of RegMed XB, Danny van Osch, Chief Business Officer at Vortoro, and Emiel Staring, Managing Director of Chemelot InSciTe. So Emiel, I want to kick it off with you. You worked at DSM for quite some time, and in recent years mainly in public-private partnerships. And you have also been involved in Chemelot InSciTe since its establishment, and I remember those days very vividly. 2020 is a special year for your organization, an anniversary year, but no lifetime event this year. So what do you think of that?
Yes, the live event that we have, a two-day get-together, was becoming more or less a tradition, so that we cannot do that nowadays because of COVID, when we have the fifth meeting planned. For some it was quite a disappointment when we decided early this year to not have this event, but look for an alternative. But I think that the alternative that we have found is also very inspiring, and the more concrete it became, I must say, all the people that I've worked with became more and more enthusiastic. Also the ones in the project that have done a lot of work to make these mini documentaries. So I think all in all it proves to be a very good alternative.
Mm-hmm. Yeah, and I must admit I've only been participating in one of those events, and I still remember the party very well.
Yes.
More than the content.
That's what many people remember.
But for the viewer that doesn't know InSciTe very well, and also has maybe some question marks on what does a director do, so what exactly do you do in InSciTe?
Yeah, let me first try to explain what InSciTe is all about. In InSciTe, we start our projects with what we call a more or less proven scientific and technology concept that we try to develop with consortia, with a number of partners into a concrete application, a tangible prototype quite often. And but we do that always in consortia because, for instance, for universities it might be too costly or too big or too complicated to take up the next step in development of such a concept. For a company it might be too risky to take that up in an early phase. But joining forces and they can be successful. That is what we do mostly, bringing parties together in consortia and try to achieve such a very concrete and tangible goal. And by combining knowledge, experience, and also our important infrastructure, we have an attractive proposition to really speed up your technology development, and we are quite successful in that.
And a lot has happened this year in particular. You moved to a new location in Maastricht, and you've also transferred a lot of activities to Medis, a new company and a spin-off from InSciTe. So why did you make those choices?
Yeah, as I said, the working model that we have developed, that is all about accelerating your research, and we started accelerating your development. We started to do that with our consortia, but pretty soon after, individual companies knocked at our door and said, can't you help us with our development, using combined knowledge and expertise, and also using the infrastructure that we have at InSciTe. And when these companies knocked at our door, we came up with the idea to provide this co-development as a service for a fee. And then Medis, the concept of Medis evolved, and then Medis was established as an independent company that helps you to accelerate your research, accelerator matrix they call themselves. Well, they decided to establish themselves as a new company. They needed a new facility, which is about 4 times as big as the one that we have developed earlier on. So we simply decided to join them in this joint effort.
Okay. Hey, that's very exciting. And if you look back at those last 5 years, what are the things that you remember most?
Oh yeah, that can be a long list, but time is short. I have been informed before.
I'll make sure of that.
But I think we started out on an ambitious goal, and you were there, so you do remember. And I think that what we have now achieved, that we see all these projects that have now gained momentum and really start to deliver upon the promises that we have made in those days. That is indeed quite an achievement, I say. We can celebrate that jointly. And to be very concrete, I think that about 9 startups now have evolved from Medis. One biomedical concept is being tried really in patients to treat patients in clinical trials. 2 more of these are on the brink of going into clinical trials. And also...
I hope you're not going to describe all 9 of them, maybe.
No, I will be...
Really
and in the bio-based field, of course, we now have the first customer order for one of our bio-based intermediates. So I think that all in all, quite an achievement.
Yeah, no, that's really great. And I think in those early days, we had some concerns about, let's say, commercial use. It's very nice to see that we have some fine examples of entrepreneurship, and that's what we will see next.
Becoming an entrepreneur is not a choice that you make overnight. The freedom that you will experience will go hand in hand with sleepless nights and worries about financial issues, personnel, market developments, and so on. You are now about to watch 2 young entrepreneurs with an academic background, willing to take this leap. Let's see what motivates Michael Boot and Alex Roth.
In order to make this product a success, we need good science. But in order to actually get it to the patient, that's where entrepreneurship comes in.
I was the project leader of an InSciTe project to commercialize and develop a new pathway from biomass to a crude oil, and from crude oil to different chemicals and materials. And in 2017 we made the decision as a consortium to spin off the project results into a new company, Vertoro. So what we do is a very simple trick. We turn solid biomass into liquid biomass, and then this can go into existing oil refineries and petrochemical plants, and we want to play a major role and help accelerate the green carbon uptake throughout the value chain.
SciCap is an acronym for a synthetic cartilage plug to treat focal cartilage defects of the knee. 20,000 patients undergo total knee replacement surgery every year. With the SciCap implant, we hope to be able to postpone that first knee replacement surgery or even make that first knee replacement surgery unnecessary. Currently, we are raising funds to start a venture so that we can actually also start to transfer the manufacturing process to a medical grade facility. To be able to get that product to the patient, the best chance of that happening is through a venture and with me as an entrepreneur. But contracts and deals are really not my thing. So I'm very grateful that we found someone who can aid us in that field.
I started my first company in 2009, and I haven't known how to pay my mortgage in 6 months from now since then. The plus is that you can do exactly what you want to do. So the company is something molded in your image of how you see the world, what you would like to achieve. So InSciTe is the, let's say, the organization that brings all these different partners together, which also manages the finances and the projects. The first thing that really impressed me was that it's extremely professional and well managed, which means that we can focus on the technology and bringing it to market, and the periphery of, let's say, managing the projects and bringing the projects into the publicity is something that's also being taken care of by InSciTe.
We are very happy to actually get the support from InSciTe's quality program to make sure that the project documentation is up to the standards required for a first-in-human clinical trial. InSciTe's education program has also helped us along greatly. And for example, programs on intellectual property and also in entrepreneurship. It's something that's not taught at university.
Normally, especially in academic spin-offs, universities have their vision on how projects should be valorized and who should get which part of the pie, and entrepreneurs have a usually inverted vision. And I think what made it easier this time around was that InSciTe has its own set of IP guidelines, which are very strict, very detailed. And in this case, it was relatively simple. But if the rules are vague, then it can be really complex.
Investment is, of course, very important, because without investment, we will never reach that first patient. So we participated in the Venture Challenge program. During that 12-week program, we prepared a first version of a business plan. During that program, we actually pitched to investors as well. That really got us excited about starting a venture.
What you see in a lot of startups is that they bootstrap. And bootstrapping means that you try to avoid getting external capital in for as long as possible. I decided with Vitoro to do it more professionally from day one for both my private situation, but also I know from experience that bootstrapping causes a long delay. So the whole bio-based is a rat race. So everybody says it's going to be this, it's going to be this, or it's going to be that. And the first person that's able to scale will probably win, and that will be the platform. From day one, and even up to this point, Vitoro never owned anything. So from day one, we've utilized lab facilities in Eindhoven at the university and piloting facilities here at Brightlands. And that just gives you so much more speed. Even if we could raise 15 million now to build our own demo plant, we would lose 3 years. The state-of-the-art facilities at the pilot plant here you can view as hardware. So all Futuro does is we come in with software or a recipe, the hardware there can run it, and then there's something coming out of the printer. But Futuro itself is not allowed to operate the pilot plant. There's, for safety and regulation reasons, there's certified personnel that is trained to do all these experiments.
Within the InSciTe facilities, unique equipment is available to us. One example is the joint simulator. Wear of the implant is a potential risk, and the joint simulator will help us in mitigating that risk. Getting to know that quality management system has also made us aware of the regulations that apply to medical devices. During the development process, we are basically mitigating every possible risk that we encounter or that we think of. The role of the participants' representative, which for our project has been Jens Thies, has also been very important. It definitely makes us more confident that we are going down the right path, and that within the past 5 years we have checked all the boxes required.
The sense in the team is that, yeah, we're really going places, and it makes everybody just get a lot of positive energy. Well, in 5 years from now, we'll have multiple commercial scale plants up and running, probably one of our own. I think we'll have to build the first one ourselves, and thereafter we have a licensing model. So we would license the technology to other parts of the world where there's a lot of biomass and a need for green fuels, chemicals, and materials.
It's a very exciting process. In 5 years, we hope to have the SciCap implant in clinical trials and on our way to CE mark so that we can gain entry to the European market. With that goal on the horizon, that is what keeps me motivated every day.
Back to the table. Danny, you're known to be quite ambitious. Hearsay. Next to your postdoc, you also worked for the startup of Vertero, which we just saw in the video. How do you feel about your project developing into a spin-out?
Yeah, I think that's really ideal for, at least for me as a researcher, because it's not only about the research and it's not only about publishing the results, but it's also about producing your research in such a way that within 5 or 10 years you can see it at a commercial scale. And for me, that's really something that drives me every day.
Yeah, very nice. We'll talk more in a minute. First, let's get an impression on how the audience sees a couple of things.
Well, let's find out what you think about entrepreneurship and spice up this discussion a little. We have some statements for you again, and we're wondering if you agree or disagree. If your idea is good enough, you don't need an organization like InSciTe to market your idea. Do you agree? Or do you not agree? We're wondering for that. If your idea is good enough, you don't need an InSciTe to market it. Well, let's see if we can already get some results of that. All right, not true. Good to hear. Okay. Next question. All property rights belong to the entrepreneur. Do you agree or do you disagree? All property rights belong to the entrepreneur. Let's see what you think about this. And maybe we already have some first results to see. Not true. Okay, very obvious. Okay, last question in this poll. Entrepreneurship courses should be organized at the university. Do you agree or do you disagree? You think that entrepreneurship courses should be organized at the university, or do you think that entrepreneurship courses, like for instance IP related courses, should be taught somewhere else. So, do you agree or do you disagree? Let's see if we already have a result on that too. True. Okay. Well, good to know that also. So there is need to organize this by the university. Well, remarkable statements. Food for thought, I think, Marcel. Seems to be some discussion possible. So back to you.
Yeah, thank you, Ingrid. I think it's great news that an organization like InSciTe is actually seen as help to commercialize things, and also that entrepreneurs don't walk away with the IPR rights. I think that's also important for the sustainability and the economic sustainability of a company. And I think that's an important statement as well, is that entrepreneurship also should be something that universities take a stake in, and also organize some of the teaching around that. So to talk about entrepreneurship and go a little bit further, I would like to ask a few questions to you, Bernard, if I may. Bernard, you've been involved in various enterprises, including startups. And as a director of RegMedXB, you try to build a bridge between researchers and entrepreneurs to work together on, for instance, regenerative medicine solutions. Are you surprised by the results of the questionnaire that you just saw?
Yeah, well, it's a very good question. I think that the audience is well aware that entrepreneurship has a place somewhere, but where? And for scientists, as far as I know them, they're very much interested in science in the first place. So where does entrepreneurship come in? Mm-hmm. And I'm very happy that the third question actually showed that the ones that are in this audience, which is of course the audience of Inside Chemelot, may be a little bit tweaked towards those entrepreneurs, but at least they say it should have a role in the education, and I do agree with that. The thing is that the moment you understand a little bit of entrepreneurship, you sometimes understand also better what is needed to get a product to the market later on. A stereotype example is the rat study that you plan to do. Is that rat study solid enough to pass through regulatory hurdles later on? Mm-hmm. Or should you have used a mouse study? Those kind of simple questions could already influence the outcome of your business at the end of the day. Yeah, and it's better to have that at the onset of what you do than halfway, and you basically have spent a lot of money and time on things that maybe are not really adding to the value. So that's very little example, very small example. But it is already driving the resources in the right way to get to the market in the first place. Mm-hmm. So, and then the spirit of entrepreneurship, which is, I think, also something that is, you have to encounter sometimes when you're an entrepreneur, that things can go wrong. Mm-hmm. and terribly wrong. You can even, have a failed company at the end of the day, as I experienced twice. Yeah. So then your mortgage you cannot pay, which is indeed let's say a challenge then to survive with your family. But luckily the third one did survive. So that brought in some cash to pay the mortgage. But that risk, that level, that risk appetite should be in your science. As a scientist, in a way, you also take risk in science. But you also should understand that later on, when you're a real entrepreneur, like Danny is, sometimes some things are at stake. Mm-hmm. Yeah. So when I studied chemistry, the more commercial side was a little bit the dark side. You would typically not move there. And I think what we do see is that there is quite a bit of entrepreneurship, and the way we now also integrated with the university programs is a big step forward. So you mentioned Danny being a real entrepreneur, as you say it, taking risks and really going there. How do you perceive this, Danny? I mean, you are obviously a somewhat younger generation than we are. So how do you see the role of society and insight together?
I think in the end, it's always about taking risk, and I think the biggest advantage that we have now is that by working with an institute of Chemelot InSciTe, you actually reduce your risks. You have a lot of knowledge there. You have a lot of people that are willing to help you. And what we see also, for example, what Michael said, in the lead times that you normally have, for example, to go to a pilot plant, so fully running pilot plant, normally takes you years. While in our case, it took only like 1 year or even less to go to that stage. And I think that helps you by growing your company and also then taking less risk, of course.
Yeah, and learning from previous experiences. I think there's a lot of, let's say, we don't have to reinvent wheels.
Exactly.
There's a lot of wheels that
Yes.
are already invented. So talking about ownership, Emile, what actually happens to a project when it does not become a startup? Is the idea being sold, and what about IPR, intellectual property rights?
Yeah, I think that the projects that we select, we hope and expect them to end up into a commercial application. So that would automatically mean that all IPR that is associated with that should at least be accessible to the company or the entity that is going to commercialize. And we simply negotiate on rights for access. And if at the end of a project, no company steps up at that moment in time to bring that further, we just simply keep it in our portfolio. And we've seen examples, early examples of projects that were technically successful within InSciTe, but apparently time was not right. And it is now being revived, and we see companies being interested in the IP that we have generated.
Yeah.
So we keep it for a certain moment of time. Of course, it may run old and overdue, but we keep it for a certain moment in time to try and find interested parties for licensing or transfer.
Yeah. Yeah, there is this concept that business ideas are sometimes also circular. Huh? It also depends on what is your exact timing to bring it to the next level.
Yes.
So Yvonne, at Maastricht University, can you mention some examples of entrepreneurship being taught there as well?
Yeah, I was positively surprised to see that people also see the university as a place for entrepreneurship education. Within our Master Biomedical Materials, we have an entrepreneurship course, also to inspire students who have good ideas to think how could that become a business. But I must also admit it's not only taught by academics, so we also invited people from the Brightlands Chemelot campus ecosystem who have experience in setting up a business to tell our students how this works. Because myself, I'm not an entrepreneur, so I can tell them a lot of sensible things, but maybe I'm not the right person to tell them how to set up your own business.
Yeah, and is it then, if you invite people from industry to tell those stories, do they tell you the successes or also the pitfalls? Because I think in learning, fail is first attempt in learning, right? So if you really want to learn fast, it is also good to look at things that didn't go well.
Yeah, I think it's a good point, but it's also integrated in our program where students do research-based learning. Also there, they have great plans, and of course, 80% of them fails, but we celebrate the 20% that is working. And I think it's a little bit the same with entrepreneurship.
Yeah. Now, also, I think if you look at development and pipelines of new developments, also in companies, it is also good to celebrate the thing that did not work and to maybe formally bury it and to start up something new. And I think there's a lot of learning in those types of things, especially for entrepreneurship. Mm-hmm. So I'm really delighted with the conversation, but I'm also delighted to hear what our audience has in any of these, if they have an opinion on any of these questions. So dear Ingrid, so what is cooking at the audience?
Yes, well, Emile, how does InSciTe provide extra support for starting entrepreneurs? Is there also some consultation or advice? How do you organize this?
Mm-hmm. Thank you for the question. As I explained earlier, I think that the objective of the InSciTe project is to end up with a commercially attractive concept that can be transferred to a startup or to an existing company. And we try to, apart from the technical development that we have, in parallel to the technology development, we also support the project in drafting a business plan to investigate the market opportunity. And the example that we just earlier saw of Alex on the SciCap project, we even helped him to participate in a national competition, which is meant for, let's say, teams that are on the verge of starting up a company, and then have them go through a process of several weeks to continue to improve their market idea, but also how to translate that into a real business plan. So there are many ways in which we help scientific entrepreneurs, entrepreneurial scientists and their teams to start a business.
Okay, thank you. a different question for Danny. What do you find most challenging yourself?
I think what is most challenging that, of course, we're also still scientists, so we also still have to publish. And I notice from, let's say, the entrepreneurial part is mostly the most exciting part, and sometimes then I miss writing my publication. So that's still something I sometimes have to do a little bit more.
Okay. Well, those were the questions regarding entrepreneurship. Back to you, Marcel.
Okay. Thank you very much. We're going to continue. So what does sustainability and medical applications have to do with one another? We'll talk about that in a minute. But Ingrid, can you tell me a little bit more about the next documentary?
What you are now about to watch is revolutionary, the becoming of a real eye platform. Numerous partners from labs all over the world working together in tackling the shortage of cornea tissue. This front-running team even went to Singapore to learn a technique to multiply cells from donor cornea tissue. And now they're the only ones in Europe able to use this technique. Let's meet Matt Baker and Stefan Gisselbrecht and their solutions for better eyesight.
This is one of the few applications where you really take someone who is missing a part of their life, if you will, missing sight, and you can be able to give that back to them or give it to them for the first time.
Corneal diseases are the fourth biggest cause of blindness worldwide, with 1.5 to 2 million new cases each year. The current standard of care is grafting corneal tissue. However, millions are denied access to this sight-saving surgery due to a shortage of cornea donors. iSight could change that by engineering corneal tissue. And with the development of artificial corneal lenses, wearing spectacles for common refractive errors like presbyopia could become a thing of the past. iSight will revolutionize corneal transplantation and refractive surgery by combining technologies from stem cell biology and regenerative medicine to engineer corneal tissue and corneal lenses. This interdisciplinary consortium builds on its partners' critical strengths: bioengineering from Maastricht University, chemistry from Eindhoven University of Technology, ophthalmology from Maastricht UMC+, and materials from DSM.
So one of the biggest benefits of this platform is it allows a patient to see again. It's simple, but it's true. Many of these solutions that we're working towards, there's really no alternative. There's nothing on the market right now that can provide these patients that sight without donor tissue. It's a bit of a risky project, but we're trying to make a big impact so that way we can move this field forward. So the way we've arranged the project is to make a large impact. And in doing so, often we have to layer knowledge as we grow. So we start with the first product that we're looking at is for expanding cells. One of the biggest problems we have is there's not enough cells, not enough donor tissue to move around. If we can get that taken care of, then we can already start to impact patients. The knowledge we learn from Work Package 1 can feed into Work Packages 2, 3, and 4 in our different products. With our different products, the ones that we develop a little bit later, they solve more specific problems in the cornea.
The partners will focus on 4 solutions. Phenosight will reduce donor cell shortage by producing iPS-derived human corneal cells. Polysight will develop a polymer-based corneal inlay to treat presbyopia patients. Clearsight will produce a corneal shield for re-epithelialization. And Endosight will create a bioengineered carrier to facilitate transplantation of human corneal endothelium. 4 solutions that will jointly have a major impact on blindness and visual impairment.
It's fun. We get to work on big challenges. So we get to work on problems that hopefully will impact patients one day. And one of the coolest parts of the job is that now we work with a really diverse group of people. And so no longer am I just working with chemists, but now clinicians, physicists, biologists, and I find that exciting.
The process is very difficult, because the cells that we're dealing with are quite difficult to handle. They're difficult to isolate and difficult to culture in vitro. When they have actually isolated those cells either die or they just behave weirdly or behave in a different manner, and you cannot use them then anymore for these kind of applications. The other problem is, of course, that these cells, so in the natural cornea, these cells typically do not really divide a lot, so they do not multiply. So we have to force the cells a bit actually to multiply. And that, of course, is something which needs quite some determined and clearly identified conditions to make this happen. We were kind of beginners in the field of corneal tissue engineering, right? And but now we're also collaborating with top teams in the world on this topic. And we made quite some progress also on the culture of primary endothelial cells, so the cells that are kind of on the inner surface of the cornea.
Yeah, so we're actually the first consortia in Europe that's able to expand corneal cells, to isolate and expand corneal cells. So already we've made a major impact on the cells that are available and the ability to get these treatments to more patients out. And what's been instrumental there is the collaborators in Singapore, but also the Euro Tissue Bank.
Well, we learned this technique from a collaborator in Singapore. That's quite a huge step that we took.
Now we can take what we've learned and directly put it into a pipeline that already treats patients.
Well, we're also kind of developing new materials, right? And I think we have quite a new variety of new exciting materials to play with now.
InSciTe's biggest impact on the project really is taking what we do in the lab to making it a real product. And that accelerating that path line is critical now in research. You've been given 4 years to try to make the biggest impact you can on a field. We're about halfway through, the train's running strong, and we hope to live up to this challenge and make the best of it that we can. It allows you to focus, it allows you to sharpen and make quick decisions along the way. It pushes you out of your comfort zone. You're forced to work with industry, you're forced to work with now regulatory agencies, with marketing geniuses, if you will. But this is the future of science, this is the way forward.
So having InSciTe involved definitely helps also to speed up the process within this project, because I think we have clear guidelines and we have clear goals. Well, in the project we're using different facilities, and I think this is also very important. This is also key to our success, I guess, because we have, of course, specialized labs. So in Eindhoven we have, for example, labs mainly for the chemistry. We have labs here at Merlin, for example, for the cell biology, but also for the technology.
Off the top of my head, this research is going on in 10 or 12 labs throughout the Netherlands and throughout the world. We've sent students internationally, but also to our collaborators within the Netherlands.
We have access to all the facilities within the consortium, but that we can also use, of course, facilities provided by InSciTe, for example.
The future is quite bright for this project. However, we've made significant progress to where we can start to get other companies interested, and we can start to even think about forming our own companies for some of these products. We work hard, we work long hours, we struggle through a lot, we have a lot of failure, and to be able to see something actually make it into a patient one day would be very rewarding.
Which can really help to improve the quality of life of many people, actually.
Yeah, imagine a grandmother who can't see her grandkids anymore, and you're able to give that sight back. That's a pretty good feeling. That's a feeling that's hard to put words on.
Welcome back. Next, we will discuss the impact of what we do on people and society. And we have some new guests at the table. We have Ludo Diels, who is working at Vito, but also a professor in chemistry and biotechnology at the University of Antwerp. And he is a special chair of the advisory committee to the European Commission on SPIRE. And we will talk about that in a minute. And Koen Jansen, the Vice President, Innovation and Sustainability at DSM Biomedical. Welcome, everybody. We're going to talk about sustainability. I would like to first remind you that it is possible to ask questions via the chat box, and we really appreciate your input. Dear Koen, talking about the sustainable medical sector, you are known for your passion for innovation and are responsible for innovation, R&D and sustainability at DSM Biomedical. You're also a board member at Chemelot InSciTe. So what do you think about sustainability in relation to medical applications?
Yeah, if you're looking at the medical industry, we have a great purpose. We are healing patients every day. Yet what we need to realize is that we have a big footprint as a medical industry. So we need to, let's say, collectively put our efforts together to improve the footprint. And we can do that in three manners. First of all, we improve our own footprint of our, let's say, plants, operations. Secondly, we enable our customers through more sustainable products. Can be bio-based, can be, let's say, longer life materials or regenerative medicines. And thirdly, we need to take up the responsibility together, I think, to do the advocacy and ensure that our voice is heard and we are going to do something about it.
So what are typical, let's say, waste volumes that you talk about?
Now, if I remember a couple of studies, if you only look at the US, for instance, every day 14 kilotons is being wasted. Yeah. And of those 14 kilotons, 20 to 25% could be recycled because it's all about plastics. Of the whole healthcare, let's say, waste, about 85% is ending up, let's say, could be separated, so it's recyclable, but it ends up in an incinerator or a landfill.
Or landfill.
And globally, if you're looking, let's say, at the emissions of the medical industry, it's about 4.4%. So if you compare it with other industries, I think we have a responsibility to take up.
Yeah, the total volume may not be as large as food packaging, but in the end, the amount of waste you generate per treated patient is, of course, stunning. And I'm very glad that that happens nowadays. Do you also see an impact of Corona right now? In Corona, there's more food packaging happening. So also non-sustainable food packaging is used there. What is happening in the medical area?
Yeah, if you're looking in the medical industry, you see, first of all, that elective surgeries, so the non-urgent surgeries, are being, let's say, postponed.
Yeah.
So the hospitals are full with, let's say, COVID patients who have the urgent care. So currently we see in the medical industry that procedures are delayed, has an impact, of course, also in the medical industry. But it gives also other opportunities to step in. So we get also new requests, for instance, to produce swabs for, let's say, the testing. Also, we are producing face masks, for instance, but we're also doing something with our PRP system, so a platelet-rich plasma system, which also can be used to do something with the plasma of the COVID patients and give it back to the ones who need it.
So how does this work in practice? Because as DSM Biomedical, you're making materials, but you're not making the ultimate end application that the surgeon is using. So you're more at the design stage, and how do you design a material to be functional in the medical space? So how do you influence that behavior basically down the value chain? I can imagine that in practice that's not so easy to do.
No, it's challenging, but as said, we need to take up that responsibility. So what we're doing, first of all, we are designing our products and our processes with sustainability in mind. And when we talk to large medical device companies, we bring that message also to them to ensure that our voice is heard. And you see more and more in the medical industry that trend is picking up. Of course, first of all, with the classical things like your operations emissions, but we also need to see how the treatment itself is more sustainable. Small example, we're working together with Aerie Pharmaceuticals. It is for age-related macular degeneration, so you get blind in the end. But if you, currently your treatment is once a month, you go with a needle through your eye, and a needle and an eye is like you peeling an onion. So you go layer by layer through your eye to the back of the eye, so you can already feel it when I'm saying it. And each month you need to go to the hospital to get that treatment. Now we have developed drug delivery systems where you only need that treatment once a month, and you get a small injection in the eye. It degrades over time, and you just get the right medicine at the right time.
So if you talk about the people element of sustainability, there's a lot to be gained if we do it that way.
Indeed.
Okay, thank you, Koen. I would like to switch to Ludo. In addition to your work at the University of Antwerp, you're also the chairman of the advisory committee to the European Commission on SPIRE, an organization where the process industry works together at the European level towards a more sustainable future. So how does that take shape, and why do you do this at the European level, and where do we go? We have the European Green Deal, I think, very exciting new things happening in Brussels. So how can we respond to that and surf that wave, so to speak?
Well, I think it started about 7 years ago. SPIRE was founded 7 years ago by the 8 largest process industry sectors in Europe, together with the European Commission as a public-private partnership, to set up a sustainable processing industry in Europe, meaning that we were looking to do sustainable energy and to sustainable resources. At that time, it all started and it was not clear at all where we should land, etc. Now it's very clear. We have, in the meantime, 10 sectors, and we have a new name, Processes for Planet, which is very clear, I think, with a very strong ambition. The ambition is to be fully climate neutral by 2050 and fully circular by 2050, and to do that in a competitive way. And I think nowadays with Corona, we speak a lot about base support of the public, etc. It's always, even with Corona, we see it sometimes difficult. And I think that here the industry, together maybe also with some support of Europe, is setting this base support and say, okay, we go for it. And in that way, we will really put a kind of standard to see the future and to only make investments in a positive way. This is completely linked also to what you are saying, to the Green Deal. The Green Deal was published just before the lockdowns, but nowadays we have also the Recovery Fund, etc., where we are seeing that the Recovery Fund will fund all those industries that look to the future and not back in history. That's really the point where we want to go. And I believe that this will strongly help the public opinion also to have a base support for this, because we will move on, we will see it in a positive way, not in a doom scenario. We will see it in a positive way, that in that way Europe will continue to be competitive in the world and will be the example for sustainability.
So do you feel that Europe has a unique role to play? We all see things happening in the US. There used to be a lot more traction. I'm trying to be non-political. In Asia, things are emerging, but let's say far away from the status where we are in Europe. Is Europe going to lead the way in this transition?
Frankly, I hope that we will not be unique, because we are not responsible enough for the emissions in the world, if you look to the rest. But of course, we have the first position here. We are pioneers, and we speak about InSciTe, where also we have a lot of pioneers working in a lot of different areas, etc. And I think by playing the role of pioneers, you will help the other ones to do it in the same way. We see indeed that the United States are moving quite a lot. It will depend a lot on certain conditions, but China is following for sure. And if they follow, we know that they can do it very fast, much faster than we can do. So in that way, we will be the example for the world. And I would like to say that in our partnership, one of the 10 sectors is the engineering sector. So this is the sector that is constructing our factories, adapting our factories to a sustainable production. And if they are the first, they will play a role worldwide to adapt the factories everywhere in the world.
There is quite a bit of emphasis in Europe on the energy transition. And I must say that I see not enough emphasis on the raw materials transition that we have for if you want to have a circular economy and use recycling much more than we do today, and also use bio-based feedstocks. There should also be focus on that raw materials transition. Is that an element that you will bring across to the European Commission? If not, then maybe
every day I try to bring elements across to the Commission, I must say. But let me first say a few words about the energy. Indeed, we see that a lot is moving in energy, but a lot will need to move in energy. So we speak now about electrification, and InSciTe is a nice example, because you have this strategy on the electric cracker, which is part of the strategy in Processes for Planet, by the way. We will need a lot of green energy, and that's still very much lagging behind. So that's really an issue that we discuss every day with the Commission.
Yeah.
But now answering on your question about the materials, I think we spoke too long about recycling. And when you look then to the definition of recycling, it's something that you throw a little bit separate away, that is sorted and then is ending up somewhere with maybe a kind of a low application. That's recycling up to now. What we want to do is really to change our primary resources into secondary resources, but that have the same quality. It's not the idea, and that's also part of the strategy here in InSciTe, that we transform plastics into some stupid materials that we only use for certain applications. We want to transform plastics into the best plastics that we can use in the future and for other applications than we have done in the past, etc.
Yeah, I would agree. I mean, performance has to become
That's
leading.
the point,
It's not that recycled products should be inferior or perceived as inferior. Thank you, Ludo. Next, we will discuss how we can help companies to become more sustainable.
A doctor can come up with an idea for better treatment of his patients. But without the right partners, further research is sometimes hard to realize. Philip Schoormans picked up an idea and put it into a retrial. In this documentary, he explains why now, with the right partners, this plan can be executed and how he's even planning to accelerate this from start to first to man in only 2 years' time.
I think it's groundbreaking in terms of the impact it will have on people's lives.
Hand and wrist injuries are very common in the Netherlands, present a major burden at the emergency department, and they can happen to everyone.
In the ideal situation, you would want to restore full normal function, full mobility, articulation of the wrist. That's not so easy with the current implants.
So with this project, we'll try to preserve the motion while reducing pain and enable patients to pursue their work, pursue their hobbies, and just enjoy their daily activities again. Back in 2016, we decided we want to do a clinical trial. We made an implant design, but during the course of the submission at the IGZ in the Netherlands, we got a little bit stuck.
A lot of the regulatory rules, the quality rules, are very complicated, they're extensive, and you need people that know how to guide you through that process in order to get a medical device approved, because it has eventually to go through regulatory bodies to get approved. And InSciTe certainly helps you to do that.
So InSciTe brings all these different parties together. It gave us the facilities, also the financial means.
We as a materials company, we come in with the materials and biomaterials expertise and the mechanical properties. From the clinician side, we get someone who really provides the advice on how the wrist can be reconstructed in order to make it useful for the patient, worthwhile for the patient. And that three-dimensional, almost gluing together and rebuilding of the wrist is achieved digitally based on the work that Zillock is doing in creating the implant and using the digital tools to create a digital file that will enable you to fabricate it.
Well, I think the real eye-opener was the world of possibilities, which were really unknown to me just working as a clinician. I didn't think it would be that easy just to interact with a big company like DSM.
We've started off with the wrist. It's an intermediate size cartilaginous joint compared to fingers or to the knee or to the heel. So what we're really looking at it's an example project that can be extended to a number of other joints. So there's really, it opens up on many possibilities.
In 2 years from now, I hope we will have a successful clinical trial in which we will treat 12 patients with this new technique. And I think from this clinical trial on, we will set out new roads. We will maybe check out some other applications, for example, other joints of this technique. And I hope that we can start to use this principle in other parts of the body. That would be the dot at the horizon for us. No, so we're hoping that after the course of this clinical trial, not only people from Maastricht, DSM, Xilog, but also other companies will become interested in these techniques, so that a broader spectrum of people can be treated with it, and maybe this technique can then also be applied not only in the wrist but also in different kinds of the body.
We drive collaboration so that knowledge has impact. Our public-private partnerships realize improved health through implants and regenerative medicine, smart materials based on renewable feedstocks in a circular economy. Ultimately, a world where chronic diseases are curable, organ replacement routine, energy production is carbon neutral, and chemistry is clean.
It's a wonderful opportunity to be able to work with all these parties about matters that we care for that can improve the sight and the lives of our patients.
It gives a lot of energy to be working on something that really can make a lasting change in the world.
In our accelerator matrix, bright ideas rapidly become innovations with impact. Joint investments save costs, and researchers form unconventional teams that cut across disciplines, sectors, and conventions. Today's ideas become tomorrow's solutions. We're a unique and growing community where academia and industry meet in an open innovation setting with ultra-modern biomedical and pilot plant facilities. Research teams receive tailored support, and unlikely matches are a huge success.
We've developed a product from scratch to putting it in a human's eye in 3 years. That's extraordinarily quick.
By being able to use the facilities that we use now, we can go to the market very fast, which is unseen before.
Chemelot InSciTe is an ecosystem where everybody learns, startups flourish, and ideas don't get lost in the regulatory maze. We take proven concepts and help turn these into market-ready innovations. Experimentation, expertise, training, and entrepreneurship are the keys to our success.
Really accelerate this translation. So that means that more innovations come faster to the market to benefit man and society.
Welcome to Chemelot InSciTe.
Let's talk a bit more about sustainable products. Yvonne, you're holding the chair Sustainability of Chemicals and Materials at the Faculty of Science and Engineering at the University of Maastricht. Yep. And one of the key items is the LCA, Life Cycle Assessment.
Yep.
Can you say a little bit more about that? And moreover, when do you think sustainable products will become the standard?
Well, first of all, life cycle assessment is a method to assess the environmental impact and a bit the health impact of a product. So you can say something about the environmental performance. For instance, will it combat climate change? Do you have a product that is better for less CO2 emissions compared to another product? Mm-hmm. I think sustainability is not the standard yet, but I see more and more interest for it. So we have more and more students who come into our program and say, I'm interested in materials, but I also want to make them more sustainable. So you see that goes more hand in hand. On the other hand, I also see like general public, when I do public lectures, who are very confused about what is actually a sustainable material. Is it something that can be recycled? Is it a bioplastic? You see a lot of confusing messages also about materials.
Yeah. Yeah, and if you go to the typical supermarket, how do you recognize whether something is, let's say, compostable, biodegradable, bio-based or petrochemical. That is not really clearly indicated.
Well, and if it's indicated, I doubt if it's clear enough for consumers. So we do that with students. We look into all these logos, what they mean, and we spend 3 lessons on it. So I think that's not suitable for a consumer who is in the supermarket and just wants to pick the most sustainable product.
Yeah.
So I think we should improve there.
Yeah. We talked a little bit about performance and also upon recycling and performance of the materials that you get. Also for sustainable products and bio-based products, they in the past had a little bit of a, let's say, prejudice that the performance was not as good. The other element that plays a role is price, of course. So if we want to have that penetration of more sustainable materials, how do you see that happening? Performance is maybe something we can solve, but price is also an element. How do you see that that is going to be influencing the whole debate?
Well, what I've seen in practice is that it's difficult to come up with bio-based alternatives that can compete on price. So most projects we have also have an added value in terms of functionality or bring something extra that you cannot bring with the fossil-based material. I think companies are also after more sustainable materials, but as long as it will not, people will not pay more for it, it's very difficult to break that rule.
Yeah, but maybe if you have your life cycle assessment and you can demonstrate that these products have a lower CO2 output than the petrochemical ones, and if CO2 becomes significantly priced, which is different than today, there may be an influence also on the pricing that customers perceive. Although, of course, the packaging cost in the typical supermarket is only a fraction of the total cost of something that you buy.
Yes, but maybe I can add something to it, because we also do calculations for companies with different like CO2 scenarios to see when their product would become profitable. And sometimes that can be very soon, and that depends a lot also on policies. How much do we want to shift to a more sustainable economy?
Yeah, regulatory clearly has an input here. And Ludo, you wanted to comment on that?
Yeah, I think if you speak about supermarkets, so let's say speak about the brand owners, and the brand owners are directed by us, the consumers. And we see now more and more pledges by those brand owners that they go for more sustainable products. It must be biodegradable, bio-based, recyclable, or whatever. And so this is certainly a strong force that we have as consumers, and I think we don't need the full support base for that. 20% is already enough to move them in that direction. And then there is no way out, and then price will go down. If we prepare products that are only consumed or bought by 10 or 20%, it's expensive. But if we move away to 80%, etc., then the price will not be more than the fossil-based, and then it's completely changing.
No, that's very true. I think we have a question from the audience, Ingrid. Is that correct?
That's correct, Marcel. We have a caller. Hello, Frank.
My name is Frank Schaap. I'm Director of Business Development for Chemelot. According to our vision, we want to become the most sustainable, competitive and safe chemical site in Europe. We have a plan to realize that, and the plan is focusing basically on 3 items. Most important is that we replace the fossil feedstock we use now, being naphtha and natural gas, by renewable feedstocks, being waste streams and bio-based streams. By doing that, since all factories at Chemelot are connected, we make the whole value chain renewable and climate neutral. The second item we focus on is electrification of our processes. And in that case, we assume that all electricity we use in the future will be green electricity. And the third item is new value chains, a cluster of new materials which are per definition sustainable by nature.
Okay, Frank, and what's your question?
I have a question for Yvonne or Emile. This is about the new materials of the future. As you know, we focus at Chemelot on replacing the fossil feedstock, but the holy grail is to develop completely new materials which are bio-based and biodegradable. In that way, we avoid the problem of microplastics in the future. My question to you is, when do you expect a new initiative from Chemelot InSciTe is coming out and is in a phase that we can start preparing industrial production of such a material at Chemelot?
Thank you. Marcel, would you?
Yeah, the question was to Yvonne and Emile. So I'm also dying to hear your answer here.
Yes, if I understand correctly, the question from Frank was about new materials, plastic materials, I assume, that are bio-based and biodegradable. And I think this indeed is the holy grail, so I'm not sure whether I have a comforting answer for him. But I think that at this moment in time we are focusing on the, let's say, the well-known plastics. I think that's the easiest at this stage to address and make sure that they are either bio-based or recyclable. And there is plenty of opportunity and plenty of value to start with that. And I'm a bit hesitant to promise a new material with all the properties that Frank is asking from us, because I have quite a lot of history in chemical industry and I have seen very few new materials that have been successful in the market. So I would focus on existing and making them greener and more sustainable.
Yvonne, do you have any?
Yeah, and if I may add, maybe not in Chemelot InSciTe, but also in other projects, we are also focusing on biodegradability of materials. It's of course an interesting characteristic. I not fully agree with Frank Schaap that would solve all the plastic problems of waste, because then it must be biodegradable in any environment, and then I wonder how much functionality we have left. So of course we are looking into biodegradability for certain applications, where you think it has an advantage to put it, for instance, in composting waste streams. But we are not per se only focusing on having it bio-based as well as biodegradable.
Yeah, Ludo, you
I
want
can
to
add,
comment?
I fully support what Johan is saying, because indeed, in a lot of cases, it's very important that it is biodegradable. If it ends up per accident somewhere in the river or in the ocean, it's nice that it is biodegradable. But at the other end, we need to keep our carbon, and we must make it recyclable so that we can turn on the carbon in the system, and we can keep the carbon as a kind of carbon sink if it is bio-based. In that way, we take away the carbon from the atmosphere and we don't circulate it just, we even make negative emissions. So that's, I think, an extremely important point. By the way, composting is just a slow burning. We make just CO2. But of course, in cases where we, I say per accident, throw it away, it makes sense. But it may not be the only way to approach. We have to recycle as much as possible of our plastics, I think.
Yeah, yeah. Yeah, talking about bio-based and biodegradable, I could make a commercial for my own company, but I will not.
After the break.
So, science and product development, is that a good combination? More about that later, but now, first, some examples.
So, let's move on to the next documentary. Unconventional teams work together at InSciTe's project. And what's more remarkable is that each project has even 2 project leaders. One of them is the participants' representative, who is responsible for the commercialization of the project. And Jens Thies fulfills this role for numerous projects. Let's see what a day of Jens looks like.
I love creating products that people actually use. I love creating products that benefit people. But to do that effectively requires more than science. So as participants representative, I'm responsible for the project team
to turn the efforts that are going on in the laboratories into something that can become a product. There are two kind of leadership roles, if you will, in the project. One is the overall project leader. They're responsible for delivering of the work packages. Professors who make sure that the scientific and technical work that's done in the work package is carried out in the right way with a focus towards developing the product. The participants' representatives' role is more the commercial role and intellectual property. So are there inventions that are coming out of the work that the project leaders are leading? If so, we'll file a patent. How does the work translate in terms of being able to create that business plan, that commercial value? The medical world is very challenging. Populations are getting older. People require more and more healthcare. Healthcare spending is unsustainable. We have to make our products and our innovations more effective, longer lasting, to try and reduce that overall cost.
MimiCard is a project to develop an implant for people who have defects in their cartilage. That can be due to all different kinds of reasons, disease, but also injury, and they need surgery. We don't have the right solutions yet. That means that the patient is going to have to go through a rehabilitation period. They're going to have to not use their joints for a while and allow things to heal. That implant is only going to last you for 10 years. And then in 10 years' time, you're going to need a newer, bigger operation with another kind of implant. And then 10, 15 years after that, you're going to need another operation with even a bigger implant. So now if you can replace these with a simple implant that is going to last for life, you can cut down these operations tremendously. So that's why we need to work on new solutions that don't have these problems. So the unique thing about this solution is it solves two problems. It's regenerative. So that means once you put it in the body, over time it's going to dissolve away and it's going to be replaced by your own tissue. And that tissue is then going to be good for the rest of your life. And the second is that you'll have pain-free function very quickly, within a matter of weeks.
I'm involved in the project Access Graft, and in Access Graft we develop new vascular grafts that can be used ultimately for patients that have a renal failure. And these patients, they have to undergo dialysis therapy, and with dialysis therapy you need access to your blood vessels via a small tube, and we call that a vascular access graft. And this tube is made of Teflon. And Teflon is a rather stiff material which works quite well if you need to bend this material, but it's not compliant with the blood vessel wall. So all kinds of problems occur then, and one of these problems is neointimal hyperplasia. And that's a process in which tissue overgrows more or less the blood vessel and the blood vessel graft. So that induces failure of these grafts. So what do we do in access graft? We develop a new vascular access graft which is based on DSM's polyurethanes. And these polyurethanes are more flexible, more elastic, and therefore also more compliant with the blood vessel wall.
Jens I find to be very interesting in the sense that he's not your typical, let's say, company person. He comes from a scientific background, so he gets just as excited and motivated by the new things that we find. But he also knows that that's all fantastic and we should do that, but we also have to keep the commercial side or the realistic side of things in mind. And he helps us walk through it so that at the end of the project, hopefully we not only have something new and wonderful in terms of science and technology, but we're also closer to an implant that, for example, we can take to preclinical testing or even to clinical testing.
He really wants to bring this into a product, and as members from this consortia, we also want to do that, but we also would like to do science that we can publish. So that's something which you need to balance.
We think of possibilities in the realms of science and technology, but Jens sees possibilities in terms of what other kind of products can you make, what other markets can you go into. And when we see that, oh, what we do is useful for this, but it's also useful for that, that actually motivates you even more.
10 or 20 years ago, if you came up with a new product and a good marketing strategy, you could sell those products if you got doctors to believe in them. Now there's a lot more influence from hospital administrators, reimbursers, insurance companies. And you also see that medical device companies, they are focused on a different point in the value chain. They're focused much more on the doctor and the hospital, not so much the early stage innovations. They much rather see those be developed in startup companies, small companies or whatever, and then acquire those. And I think what's really great about InSciTe and how it fits into, you know, the whole ecosystem we've been building in this part of the Netherlands, you know, Eindhoven, Maastricht, and that whole area, we're perfectly placed to now take these projects and keep growing them in spin-out startup companies and getting them to the point that they are very compelling, that these guys want to actually acquire them or sell them on the spin-out company's behalf. So we are in the process of spinning out a couple of projects into companies. I'm really excited about that. And if you can do that in a way that creates jobs, good jobs, and value for society, it's great.
Welcome back, everybody. So we have some new guests at the table. Welcome Patricia Dankers, Professor of Biomedical Materials at Eindhoven University of Technology. And we have Rianne Grant, postdoc at the Merlin Institute of Technology-Inspired Regenerative Medicine. We're going to talk about streamlining the innovation process in general and at Chemelot InSciTe in particular. I would like to kick it off with you, Patricia. You increasingly see that science and product development go hand in hand. And your passion lies more with the fundamentals of our science in addition to the application. So how do you feel about that balance?
Yeah, thank you for the question. Indeed, I love fundamental science, but I also love to bring a product to the market. And you can say that doesn't go together, because fundamental science is really dig into a problem, while bringing a product to the market, you have to do other things. And my advice would be to choose one. I mean, in one person, so a researcher should choose for a certain period of time to really do fundamental science, but the other researcher in the same research group could focus on the application. And then together you can bring a real invention, I believe, to the market. Mm-hmm.
And are we doing enough in the Netherlands or in Europe in general to stimulate both sides of the coin?
No, I think we do enough, but I believe we also need to invest more in fundamental science. We are not for that here today, but I think that's one point I want to make today. But also, I believe that also to bring real science into products, we also need to do something else. We need to go to higher TRL levels, and that's an example of what is really done in InSciTe. Mm-hmm. And I think that's the strength of this institute.
So how do you then see the balance between, let's say, if you have the fundamentals of that let's say, new invention, how do you see that push from the science in balance with the pull from the market? How do we bring these two together? Yeah. That's quite a challenge.
Yeah, that's really a challenge, and I also think that sometimes it's not in balance. Mm-hmm. So I think sometimes you should leave the researcher with his or her fundamental problem and work on that. Mm-hmm. But also, I believe that also, you need to invest in this product. So you have to choose. So that's always my advice. Choose what you do for a certain period of time, and then, you can of course switch after that period of time. But I don't think you should mix up fundamental science and product development. implants. I think that doesn't go.
And you do see also different species in the innovation ecosystem.
Yeah.
Some really feel very comfortable with the application side, whereas others are really they want to go deep. Emil, you wanted to say something?
Can comment on that? I think we fully agree on how you said it, and we see also that happening in practice. When a project of InSciTe start, of course, we get a new group of fresh researchers at the start, and we see some people that really get taken by focusing on the real application and bringing that forward, or even building a business out of that. And we see people indeed that are much more comfortable in digging deeper into the fundamental issues. And I think more fundamental research and application development, they should go hand in hand, because if fundamental research is not performed at a sufficient level, size and volume, then you'll say we get short of initiatives that we can develop further. So they should always go hand in hand as a system, but also in persons.
Yeah, but I think what I said, it's important to not mix it up, because I'm afraid that you then end up with nothing. So you don't have a very, very good fundamental science, but you also don't have a product. So then you're in between, and so therefore I would say you have to choose what to do for.
Mediocre doesn't give you a lot of money. And not a lot of satisfaction either. So
no, that's true. Indeed.
And not a publication that you want.
And not a product. So,
well, there we go. So talking about publications, Rhiannon, you work at InSciTe, a project within InSciTe. And PhD students obviously have to publish. So this is often not so easy with a commercial product that you're developing. So how do you see that? Are you running into these kinds of issues?
I think it's obviously important that PhDs and postdocs publish. I think I agree with what Patricia says, where it has to be a balance between the two, but also I think they have to be kept separate. And I think that decision has to be made at the beginning of projects by people above PhDs and postdocs, because we are governed by where our funding comes from, and we can't go against that. So if you tell us to generate patents, we will drive our research in the direction of patents. If you tell us to generate publications and do fundamental research, we'll do that. We're capable of both, but we can't do them concurrently. And I think the problem that people run into is where researchers at my level feel that we're just not sure where to put our final results. So I think if decisions were made early and clearly at the beginning of projects, it would completely solve the problem.
Okay. But in essence, I mean, you would be allowed to publish, but have to wait until a patent is filed? Or are there some inventions that you cannot even publish at all?
It depends on the project. It depends on the research. And it depends on the PI and the people in charge. Sometimes good research does get trapped waiting for patents, waiting for people who have more experience, so IP lawyers and such like, deciding whether or not this is patentable. And in that time, you can lose your novelty for publication. Whereas if a decision was made at the beginning and you knew you were driving for that process might happen faster and you'd completely avoid that issue. But to researchers, that outcome is, I don't want to say equal because they are different things, but we're equally happy with patents or publications from my perspective.
In the end, if you realize an application and have played a significant role in that, for instance, in improving patients' lives, right? That is, in addition to having a publication, that's also a very nice result to be proud of. Right?
Yeah, but also let's not dismiss fundamental science, where having contributed to your field and your colleagues and enabled further research is equally important to helping patients in the ward.
Maybe I can add it. I think it's also important to what you say to discuss that in advance, because you do different experiments for a publication versus a patent application or a product. So I think that's important.
So Emil, I'm curious to know how you see this. Also, in the light of the future of Chemelot InSciTe, you're building up an IP estate, you could say. Yeah? There's value that is generated in these projects. So how do you see that?
Yeah, I think that on the earlier discussion we just had, I see that also things at universities are changing. Earlier on, I think that the emphasis on your let's say your performance track record at university was the number of publications and the journals that you were publishing in. I see a shift now that also generating IP that is valuable is also going to be a measure of success for you as a researcher, so things are changing there. Well, when it comes to IP versus publication in InSciTe, we know sometimes the dilemma that exists there, and we don't want to withhold publications for too long a time, but still we want to see what value might be in the technology that is being developed. So what we do typically is that a publication, when it is drafted, it is for review given to a selected number of people within the project, known people, so they know that they are there for that reason, and the author knows that they can go there. And they evaluate whether there's anything in there that could destroy commercial or patentable value. And that is then being checked. We have so far never seen a publication that was rejected on that basis. We have seen publications where a sentence was left out, or a compound had to be named differently, or some data had to be presented differently. But usually it goes pretty well.
Yeah. Okay, that's very good. Later we will talk more about the future of InSciTe. But first we have a few questions for you, and Ingrid will take you through the InSciTe quiz.
Yes, thank you, Marcel. Well, we are near the end of the show, almost. And, well, we would like to test your knowledge at home of our viewers to see how much you know about InSciTe. And we will do that by Menti again with a multiple choice quiz. So you do have a chance to get it right if you don't know exactly. First question. The first question is, how many startups has InSciTe been involved in? So how many startups has InSciTe been involved in from the very start? And with involved we mean started and settled at InSciTe. You have 3 different options, 3, 5 or 9 startups that we have been involved in since the start. Well, let's see what our viewers think and how many startups. The time's up. And, well, most of you voted for 5 startups, but, well, we're speeding up, and by the time now, there's already 9 startups we have been involved in. Next question. How many partners and universities are now connected to InSciTe? How many partners and universities are now connected to InSciTe? Let's see what you think. How many partners? Is that 23 partners, 36 partners, or 52 partners? So you can choose A, B, or C, 23, 36, or 52. So those are all the partners and universities collaborating within our research projects. And let's see what you think. The time's up now, and let's see the results. Oh, really good, 36 partners. That's very correct. Thank you. Next question now. In the 5 years of InSciTe's existence, how many people have participated in the training courses? So in the last 5 years of InSciTe's existence, how many people have participated in our training courses? Is that 250? Answer B, 500, or answer C, 840? So this involves all our courses, both the bio-based and the biomedical courses, IP courses, the LCA course. So all that together is that 250, 500, or 840? Let's see what you think. 840 is the correct answer. So yeah, really good. Okay, then we have come to the last question. And I can reveal that already. How many research projects, including OP Zuid related projects have been carried out within InSciTe in the last 5 years? We will wait to see your options. The answers A, B, and C will be A, 9 research projects, B, 18 research projects, or C, 33 research projects. Let's see what you think. So both the bio-based and the biomedical and including the OPZID European co-funded research projects, how many projects did we realize? Let's see what you think. And the right answer is 18. All right, well, Marcel, at the beginning of InSciTe, you were involved. 5 years later now, did you think we would become to have these results?
No, thank you, Ingrid, for that nice quiz. I'm actually impressed. Especially how many people have been involved in training course. I mean, 840 people that really, let's say, enrich their knowledge to do this. I think it's very nice. 18 different projects, so really impressive numbers, I think. I must also say that quite a few people had the answers right. So there must be a newsletter or a website that has been consulted really well. The thing that we did not mention, did anybody win, Ingrid?
Well, we will get back to that. No,
Okay.
there's no winner yet.
Now, there is a trick that we've built in, because the speed at which you give the answer was also taken into account. So we may follow up on that. So we will now discuss the future InSciTe, as I previously announced. And we will do that with Emil and Koen. So Chemelot InSciTe will be discontinued at the end of 2021. So what happens then?
I think discontinued is a bit of a harsh word.
Yeah.
But, we come to a natural end, I would say, in the sense that we have given funding to start the 18 projects and to do all kind of other things. And that money is running out by the end of next year. But as you can imagine, we are planning for the next phase. I think that both for the bio-based / sustainability area, but also for building a future life sciences industry in the Netherlands, in the region, I think that the stakeholders see that as of prime importance. So we are working with them for follow-up. What we do see is that what we have now, bio-based and biomedical, to put it shortly, under one roof, we see that they will probably have a different route to take. There are a lot of sustainability issues, sustainability projects and initiatives at the Chemelot campus, like Brightside, like the new Chemelot Circular Hub. And I think that our experience in scaling up and also the infrastructure and knowing how to use that will be an asset for these initiatives. So it would be natural if they would join that. And for the biomedical, we are currently developing a value proposition with our stakeholders, which we've also discussed with, for instance, with the province of Limburg, which I usually describe as being of a 3-layer approach. The first layer being that we are planning to install what we call a Limburg Biomedical Innovation Board, which aims to, let's say, provide an overview of the initiatives and life sciences that exist and the important participants in that, and can jointly then prioritize and also be an advocate towards other stakeholders like local and national governments. And the second layer is the ecosystem that we have described. The players there, some of the history, but also focusing on the future and also what has been invested there in the past and what has it contributed, what has it brought us today. So that is the second layer. And the third layer then is when it comes very close to Chemelot InSciTe, is what we call a first in human program, where we actually want to develop technologies for a first in human application, which is a step further than we do now, because now we usually end up with a prototype, and if it works well, we end up in the first in human situation. But we're now taking it a step further, and also maybe not having a startup company at the end of a project, but a startup company at the early phase of a project, which you can then steer by a funding mechanism based on deliverables and milestones. It is a bit more result oriented than we have today. And that's a value proposition that we are building with stakeholders, and Koen is also one of the stakeholders.
And Koen, is DSM fully on board with this? I don't want to provoke any
can never
any
give
reaction you can't give, but
I'm not allowed to give future-based statements. Yet we were, let's say, deeply involved in the discussions, and we're also active in the dialogue. And I think there are a couple of critical elements we want to see in InSciTe 2.0, or how we're going to call it. First of all, I think we believe in ecosystem innovation. I think in the area where we all are, you can almost use your bike and you find your partner in the value chain. Yeah? So I think we need to make use of that asset, not only in the Netherlands, the southern part of the Netherlands, but also close to Belgium and Germany. So ecosystem innovation is important to get speed, but also to get, let's say, a non-competitive environment that you really add on instead of that you compete. Yeah. Second is indeed the focus on biomedical. I think bio-based and biomedical, they can go hand in hand, but we like to bring more focus to the program. It's also important to bring in, let's say, a way of doing research, and we would like to see more venture type of projects. Yeah, so that you say, hey, you create your own company. Would also be very nice for postdocs like Rihanna. Huh? So you said, okay, we believe in a topic. We bring together a CEO and an expert team, yeah, who can fully focus, let's say, to grow that venture. You have a stage-based approach. You have also stage-based financing. I think that would be appealing. I think, but what we miss still in the area is, let's say, a venture funds. If you're looking at preclinical trials to clinical trials, it's vary between 5 million and 150 million, depending on what you're going to do in a trial. And that's a lot of money also for, let's say, a venture. So if we have, let's say, can bring parties together, and there's a lot of money available in the Netherlands, but certainly if you go interregional, can we, let's say, set up a partnership around venture funds who are going to fund those ventures? Yeah. And then the last element, sustainability. I cannot stress it enough. We allow that to the future generations. They live on the planet when we are gone, and I think they deserve also a bright future.
Yeah. I'm very happy to hear you about the ecosystem of innovation, but also the ecosystem in our society that we need to address. And I think the culture of collaboration that you see so very much in connecting people in InSciTe is, I think, something that this region can really profit from. And I'm also glad you mentioned that stepping across the border, because there's a lot of very valuable partners also just outside the Netherlands that are still close enough to collaborate with. So that's very good. I would like to switch back to Ingrid. We have some questions from the audience.
Yes, we have a connection with one of the viewers again. Hello. I'm curious about your question.
I'm Chris Duxbury. I manage the Medace facilities. For those of you who don't know, Medace is a new biomedical co-working space located here on the Brightlands Maastricht Health Campus, where InSciTe biomedical projects, as well as other biomedical startups, can use and tap into our services.
Thanks, Chris. What's your question and who would you like to address? Okay.
InSciTe has provided support with getting you to where you are now, but what further additional support or training do you think is most important to accelerate and to get through the clinical trials and then to the market?
Okay, as if I understand correctly, Rhiannon, InSciTe provided support with getting you to where you are now. What further additional support would you need to get clinical trials to the
that's
market?
an opportunity, Rhiannon. I would say go for it.
God,
mention the list.
Right, okay, Emil, I need this, I need this, I need this. No, it's $1 million question. I mean, the answer is always longer contracts and more funding. So is researchers at my level have more time to get things. I mean, obviously it can't last forever, but realistically, like if we take, for example, the project I'm on, InSciTe, it's a 4-year project. I've been here for a year and I've got a year left. It's not that long. So maybe something like a transitional program at the end where you look at the talent and the skills that have been developed by researchers, and if they can't be, if something isn't spinning out maybe from their project, maybe they can be used in another one. Maybe they have the skills. Because I think in terms of infrastructure, particularly at Medace, I work at Medace as well, we have help with things like regulatory, QA, all that expertise is there. So maybe just because your specific project isn't quite at the point of a startup or a spin out, maybe your skills could be used in other projects in some sort of transitional phase would be useful.
All right.
Okay.
Thank you, Rhiannon. Chris, would that be the answer to your question?
So, thank you very much for answering my questions, and good luck with the show.
Okay, thank you. And then from Maastricht, over to you again, Koen.
Okay, thank you. We're actually close to ending our annual meeting. Time flies when you're having fun, I can tell you. But first, some more highlights to share with you.
And on to the next one. Let's take a closer look at the more unknown side of research, guiding you through regulatory issues and quality assurance, which is of key importance for the success of a project. And it certainly brings on new challenges for our collaborating partners. Paul Willems and Colleen Bones-Salen share their learnings from the development process of a new treatment for scoliosis patients.
What we do now really affects the lives of patients. That's great. That really gives me a very proud feeling. The posture project focuses on scoliosis. And scoliosis is a 3D sideways curvature of the spine. It can affect both young children and elderly. And what we did in the posture project is we tried to design a more optimal treatment method for, well, at first for these young children. Current treatments consist mainly of metal rods and screws, and for children there are some options to allow growth, because if you just apply metal rods and screws then it's completely fixed and the spine cannot grow anymore. But then still there is often metal on metal articulation, which is not ideal, or multiple surgeries are needed to allow for that growth. So that is both physically but also psychologically very heavy for them.
Can really give good correction of the spine, but still allows for growth in younger children. That's the importance of the Dyneema material that we specifically use in this project, because this is really very strong. So instead of multiple operations, we can do it in one operation. That's our hope. Not only physically, but also psychologically very important for a younger child. It doesn't need constant reoperations.
And also in the elderly people, where there is degenerative scoliosis, if you use the rods and screws there, it can lead to problems of screw breakout, because you can imagine that those people have osteoporotic vertebrae, so they are very weak. We designed a cable that could go around the vertebrae, and that cable would still be connected to those existing rods, so the rods would still correct that spine, and the cable would allow for growth because it just slides along those rods when the child grows. So we used material from DSM Biomedical for that. Yeah, with one surgery it would be done, the spine would be corrected and the child could just grow until maturity, and then yeah, it would be fine. It was the first time for DSM Biomedical here in the Netherlands to be legal manufacturer of a medical device. It was also the first time for MUMC Plus to be sponsor of a medical device clinical trial. So we learned that especially that legal manufacturer role and that sponsor role were very important. We also learned what the responsibilities of those roles were, and also what the deliverables were. What did we actually have to document and deliver in the end to be able to conduct that clinical trial. But then there were also two accessories that we were designing, but those were designed and developed by different legal entities. So it was not just DSM Biomedical BV as a legal manufacturer of the cable, but also DSM Biomedical Inc. in Exton as legal manufacturer of the leader, one of those accessories. And in the end, it was MUMC Plus who did the in-house manufacturing of the tensioner, the other accessory. Those three devices had to come together as a system, work together with the existing rods and screws, and that system has to go into that clinical trial. I could definitely not have done it alone. DSM Biomedical could not have done it alone. We really needed this cooperation, and InSciTe facilitated that cooperation. And it's a lot of interactions. It's interactions with the clinicians, with the engineers, with the regulatory people, with the quality people, and also the Clinical Trial Center of Maastricht, where also InSciTe was very instrumental to make arrangements with them so we could use their expertise, and then trying to bring that all together, document it properly. Next to designing these implants and preparing for this clinical trial, there's also work streams in the project concerned with improvements already of the concept. So we're working with Xilog for a crosslink device, and we're also working with the Eindhoven University of Technology for a software system to assist the surgeon to use the most optimal construct. So where do you place cables, where do you place screws? So it's really very complex. My job did change because in the course of the project I got a regulatory assignment within DSM Biomedical, and that turned into a part-time responsibility. So I'm now next to being a senior scientist, I'm also this regulatory and product safety specialist. Yeah, I'm very proud. It's great to be part of that committed team that really wants to make this work. I think for the child, it's great if they look more like a normal child, if they stand upright, if they don't feel a pressure in their chest maybe because they can't breathe normally. Knowing that they are done with that one operation and not having multiple operations looming in front of them, I think that's great for a child and also for their parents.
Dear audience, this brings us to the end of this first annual meeting, the first virtual annual meeting. I would like to thank the people that we had here in the panels for their active participation and very good discussions. And also you as an audience, that you participated well with your questions, and also the answers to our questionnaires was making the show a little bit more lively than we otherwise would have been able to do it. So really would like to thank you for that. Frankly, I still miss the party, but it was a really good alternative. What about you, Ingrid?
Party also, but it was a good alternative. It gave us an opportunity to show you a little bit more about behind the scenes of what we do, well, of course we would like to have a live event again next year, which we will hopefully welcome you all. But also thank you very much for watching. Thank to all our guests and all the participants in the video, the team of Makers and Veenstra who made this all possible, and the team of Chemelot InSciTe, of course. So thank you all, and take care. See you next year.
Bye-bye.
Bye-bye.
I'm convinced that you will have a very interesting and enjoyable afternoon in this InSciTe meeting.
Thank you very much for joining this very special edition of our annual meeting, and hope to see you next year. Stay safe.
I'm very proud to work in this inspiring environment, to support the innovating projects of Chemelot InSciTe, and to be part of this fantastic team that has organized this online annual meeting. Stay safe.
We must stop exploiting fossil resources. Use energy from the sun instead, or nature for materials. InSciTe helps entrepreneurs to realize their bio-based and circular dreams. So, join us.
I see and experience the groundbreaking science and creativity of the project members daily. It is this interaction of different expertises between different people that creates the magic of InSciTe. This inspires me and motivates me to do more.
Besides the hotshots that you've seen today, there's a whole army of bachelor, master, PhD students, postdocs, technicians, financial personnel that worked very hard to reach the results that you've seen today. I hereby want to thank them all.
I really enjoy to work with this motivated team. I believe that we can contribute to a better world with our bio-based and biomedical projects. We've achieved a lot with a small team in the past few years, and I'm really proud to be a part of that.